Hello, I'm Dr. Bleu Schniederjan with the Panhandle Weight Loss Center. Today I want to visit about what we call medical tourism. We have a lot of patients that we sit down with every day in our clinic wanting to lose weight and considering a weight loss surgery. A lot of these patients are concerned about the price and therefore are considering going to Mexico. A few things I just want to talk about is number one is kind of the risk of that and just the long-term thought process. Number one, we understand, and our goal for all our patients is trying to provide safe, affordable care to patients in the United States. Second thing is when considering going to Mexico, there's been a few things that at our society meetings that we've discussed. Last year we had the pleasure of going to Texas ASMBS meeting, and one of the surgeons was a physician he's a physician along the border in South Texas. He presented several cases about patients who had went to Mexico and came back and ended up with a complication in his hospital. The few of the concerns that were raised was patients would go down for an intended procedure such as a sleeve gastrectomy or a band, and they ended up getting surgeries that they were not supposed to get. They would get a gastric bypass, or they would get some other version of a bariatric surgery that they did not want to get. And these patients did not know that until after the surgery. The second thing is the concerns of a leak. After any of these surgeries, that's our primary concern for any patient or any risk to any of these procedures is either a gastric leak or an intestinal leak. Based off visiting with our colleagues, this ranges from anywhere from 1.8% up to 18%. After going to several of these meetings and talking to colleagues who have taken care of patients from Mexico. So I just want to really caution patients to really look into the risk profile of the surgeon that they're considering having surgery. The last thing I want to visit about is a long-term weight loss and health. Number one thing that we've realized over the years is these surgeries, they can be very effective, but the key component is the lifestyle modifications. And education prior to surgery and after surgery is what we have seen long-term that helps patients keep the weight off. And our concern is in a lot of these processes, such as going to Mexico, there's very little education and patients aren't taught how to use the tool. And so I really encourage patients to consider all these things when they're considering going out of the United States to get surgery. Thank you.